Today is February 13th, 2016. I'm up here on this beautiful day on my weekly hike with Dr. Sen, discussing our patients and our findings of the week. And he has some findings he wants to report on me, of all people.
I saw Robert this Friday, and
Yesterday.
and I'd seen him now for 11 years, and Robert's a dear friend of mine, and I'm always concerned about his gums. I don't know what he did, but every time I took the periodontal probe, which was that probe you put between the gum and the tissue, I'd put it, he would always bleed quite a bit, and I'd say, Robert, what are you doing? I'm brushing my teeth. I said, I'm still bleeding. There's a lot. And the pockets would be 3-4 millimeters.
Some fives.
A couple fives, yeah. It's pretty crummy. And I said, well, you know, you're just, whatever it is, something in your diet, something in your physiology, I don't know. And I just kind of lived with it. And I didn't want to be the bearer of bad news with you, but I was always concerned. The last time...
And your wife?
The last time Dr. Rowen, Robert, saw my wife, Dr. Mann. And she came to me and said, holy crap, did you know that Robert's gums are bleeding? I said, yeah, I've known that for 10 years. There's nothing much we can do about it. Everything's been about the same. They don't seem to be getting any worse, but they're not getting any better. I'm concerned, you know, if he starts going to 6 millimeters and 7, then we're really in trouble. I don't think he's going to listen to me. You know, we're friends, but, you know, friends don't listen to friends. Robert came in, like I said, yesterday. I started probing. And I said, oh my God. I was in disbelief. I said, okay, I started with, like always do, tooth number 2. I started there and I go, wow, 2. I said, pockets are at 1 and 2 millimeters. Couple 3s, no bleeding whatsoever. I did his whole mouth. The biggest pocket I had was 4 millimeters with no bleeding, at 2 or 3, 4 millimeters. A lot of 1 millimeter pockets, which he never had before.
Most of them were 2.
Most of them are 2.
And occasional 3.
Occasional 3, but there was no bleeding. 0, none. And the bacteria is different. It's changed.
What about the plaque, you said?
The plaque is different. There was a thick, viscous plaque. And I said, Robert, what is this? You're eating too much vegetarian food. You're eating too much carbohydrates. You got to watch this plaque.
No carbs. I'm a
raw
fooder.
I know you're raw food. I couldn't figure this thing out. But the plaque was very light and easily removed. Almost none. Yesterday. But you haven't changed too much in the way your regime is, right?
I haven't changed anything. I haven't changed my flossing or my brushing.
What you've changed is you've done ozone therapy.
High dose ozone.
High dose ozone therapy. What's called a 10 pass.
Right.
And I picked it up. That's the only difference you can pick up. It's amazing reversal in his gum health. I'm still in disbelief. This morning I talked about it with my wife, is Tony Mann, Dr. Mann. I said, I still can't believe Robert's gums. We got to take this, do something with it. And if someone does have a gum problem or a periodontal problem, one of the therapies should be ozone, total body ozone therapy, because if anybody really knows what's going on, gum therapy, the disease process just isn't in the periodontium. It's a total body disease, and that's just a manifestation. But let's go one step further. Let's back up. If you're having that much inflammation in your gums, that is the window on the body. That's what I call that. If you see thick, gooey saliva, bleeding gums, kind of a nasty situation or nasty environment there, that is just the window on the total body. Your body could be sticky, inflamed, etc., etc., etc. That means that the inflammation's virtually 0 in his body, and the stickiness or the plaque, the stickiness in the biofilms is almost gone, or it is gone, virtually gone. So the whole body has changed, not just the periodontium. This is a change in how we're going to view dentistry and medicine that happened in my office yesterday afternoon. A total change how we're going to view this. I'm just totally still in disbelief, and I don't know what we're going to do about it. But I'm going to go back. I'm going to review his chart, look at all his pockets. I'm going to write it up. I'm going to do a little statistics on it, saying, Robert, we did it. So anyway, you'll be seeing this on his Facebook post, and we're going to work on this. And I've got some other people I want to work with that have gum situations that I know of, and we can do 10 passes or 6 10 passes and evaluate it. I could see
10 years of this I've had with you.
Oh, 10 years.
And you guys bemoan it every time.
Yeah, you always came in, it was lousy. I said, oh, let it be. But this is totally different. This is unique. It's a total transformation in your periodontal health, which means that your whole body health that is totally changed.
Because we know the periodontal disease is even associated with heart disease.
It's heart disease, all vascular disease. It means it's all gooey in there. It means the gooey. I don't know why it was gooey in Robert, but it isn't gooey any longer.
I wouldn't have expected it to be. I have a very clean lifestyle.
I know clean lifestyle, but why was it always that way? I have no idea. Maybe it was just living in your periodontium, but now it's not. Maybe it was affecting everything else, but now it's not. Anyway, thank you. And I know we're going to take this to the future. I know we've changed medicine and dentistry as of Friday afternoon, as of February 12th, 2016. It has changed. We've got a definite transformation in our future of healthcare.
May I post this?
By all means, post it twice.
Thank you, Silvano.
Thank you.